In this video, we'd like to continue on our series of PCOS diagnosis and treatment, and today we'd like to make classifications of different types of PCOS that you may not know. So today we'd like to discuss this topic. So PCOS, in our experience, generally there's 4 broad categories, and then because of the classification, each different category has its own specific treatment. That's why patients with PCOS will see different treatment depending on their own individual condition. Not one patient will have the exact treatment because some patients may have a combination of categories. So the treatment is quite individualized and specific to that individual itself. So let's go into the topic of the classification. 4 general groups that we see. The first one, which is the most common form of PCOS, is due to a congenital deformity of the gonads, which means there is a presence of these Leydig cells causing hormonal imbalance. So this first category is usually encompassing hormonal imbalance, causing the general symptoms that we know. Because they have high testosterone, they will have symptoms such as acne, excessive body hair, masculine secondary sexual characteristics that we are commonly see in women who have PCOS. This is in fact the most common one that we see, and is quite general PCOS. The second category, which is also another specific condition of a PCOS, another category of PCOS, which is related to altering or affecting the metabolism of the patient, specifically metabolism of glucose and fats. So usually this type of PCOS patient will have obesity, or they have excess fat storage on their body because of the metabolism being affected, causing what we know as insulin resistance. So usually these types of patients, they will not only have the general symptoms, they will also have some form of obesity as well. Furthermore, they will also have type 2 diabetes if they go on for very long periods of time without actually treating the underlying PCOS. And furthermore, they also might have some dysfunction with the thyroid gland, causing them to have a generally higher body temperature, and also they might sweat a lot as well. And this is all caused by their metabolism, systemic metabolism being affected by the PCOS. The third category of the general broad category of PCOS is about congenital organ deformities. So what do I mean by that is that this group of PCOS patients usually have some different formation of organs, specific organs. First of all, we'd like to talk about the stomach. Now, in general, the stomach might have a normal stomach with a 45-degree to the 45-degree against the axis. So it's like a general J-shaped stomach, which is the most common form, the healthy form of stomach. However, these types of patients, their stomach has a formation of a degree less than 45 degrees, sometimes 30 degrees, 15 degrees, almost parallel. So these types of stomachs would store a lot of food and also cause accumulation of body fat. But this is not due to the insulin resistance, it's actually caused by the shape of the stomach itself. And this requires some surgical intervention. So furthermore, not only is the stomach affected, let's talk about the uterus as well. This group of PCOS patients, they also have some form of malformation of the uterus. The most common form of malformation that we see is the septate and also naive uterus. Some small subset of groups will come with a short cervix as well, associated with this PCOS. And next up, they also might have some deformity with the fallopian tubes as well. What we see is that there might be a duplication of the fallopian tubes. Instead of just 2 normal functioning fallopian tubes, sometimes the fallopian tube might open up, duplicate itself into multiple fallopian tubes, and this will affect fertility as well, causing them to have difficulty in getting pregnant and also recurrent miscarriage, because these fallopian tubes also have a fatty accumulation as well, which affects ovulation, fertilization, and in general is caused by these organs deformities. The last broad group of the PCOS classification is about behavioral abnormalities. Now, these types of patients with PCOS, they might not have the obesity or the metabolism abnormalities, but they have behavioral differences from their counterparts. And in the root cause, it's due to the endocrine imbalance, a hormonal imbalance. However, this group of patients have much more distinct, obvious behavioral changes. So what type of changes do they observe is that usually these women are much slightly more aggressive, much more masculine women, and then they are also very conflict seeking, and also sometimes easily irritated. They might experience some mood swings, some aggressive behaviors. These are usually associated with the underlying PCOS and the high testosterone that they have in their bloodstream, but they do not see other symptoms that we commonly associated with the other types of classifications. So depending on which group that you fall in, you might fall into one group or multiple groups. The treatment that we will administer for you will be different. So from patient to patient, we need to assess your individual situation, your criteria, what type of classification do you belong to, and then we need to give you the proper treatment. Although the underlying root cause is still the presence of these Leydig cells, so without a doubt, we still need to do a laparoscopic surgery of the ovaries to remove the Leydig cells, and afterwards we need to do, depending on which classification you belong to deal with the metabolism abnormalities, the surgical correction of the stomach shape, the removal of the fatty accumulations of your fallopian tube and the pelvic cavity, and also medications to bring back balance of your hormones as well. So this PCOS, although it seems to be one of the most common conditions, the treatment is rather complex and specific to the patient's individual needs. So to find out more information about PCOS and how Antai-Hospital evaluates and offers you individualized treatment, please schedule a consultation so that we can assess your condition more specifically and offer you the specific treatment that you need so that you can overcome PCOS and achieve healthy pregnancies, avoid recurrent miscarriages, and also generally have a better quality of life because of all the symptoms that's associated and how it can affect your appearance, your diet, your mood. All of these can be achieved, all of these can be overcome by seeking the proper treatment with Antai-Hospital.